arriving to take her seat in the gallery that is set aside for her up above the chamber. There's always a certain group, certain members who crowd the aisle so that they can be photographed on national television greeting the president as he comes in. Subject, not to mention the hundreds of instances in which he has discussed the issue in other public settings.
Is really within Democrats. There's all this talk about Republicans and how they don't have plans.
Madam Speaker, the President of the United States.
Being said, and sometimes I'll pick up a newsworthy tidbit.
Has a challenge as the majority looking down, and there you see a...
You know, it's an intriguing question. Be that they would cost something on the order of $1 trillion.
Members of Congress, I have the high privilege and distinct honor to present to you the President of the United States.
Healthcare. I am not the first president to take up this cause, but I am determined to be the last. To meet this challenge, year after year, decade after decade, has led us to the breaking point. Everyone understands the extraordinary hardships that are placed on the uninsured, who live every day just one accident or illness away from bankruptcy. Middle-class Americans. Some can't get insurance on the job. Others are self-employed and can't afford it, since buying insurance on your own costs you 3 times as much as the coverage you get from your employer. We are the only democracy, the only advanced democracy on earth, the only wealthy nation that allows such hardship for millions of its people. There are more and more Americans pay their premiums only to discover that their insurance company has dropped their coverage when they get sick or won't pay the full cost of care. It happens every day. This is one of the reasons that insurance premiums have gone up 3 times faster than wages. It's why so many employers, especially small businesses, are forcing their employees to pay more for insurance or are dropping their coverage entirely. And it's why those of us with health insurance are also paying a hidden and growing tax for those without it, about $1,000 per year, that pays for somebody else's emergency room and charitable care. Well, the time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care. Now is the time to deliver on health care. The plan I'm announcing tonight would meet 3 basic goals. It will provide more security and stability to those who have health insurance. It will provide insurance for those who don't. And it will slow the growth of health care costs for our families, our businesses, and our government. Here are the details that every American needs to know about this plan. First, if you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick. Companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. Now, if you're one of the tens of millions of Americans who don't currently have health insurance, the second part of this plan will finally offer you quality, affordable choices. If you lose your job or you change your job, you'll be able to get coverage. If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange. Insurance companies will have an incentive to participate in this exchange because it lets them compete for millions of new customers. Exchange will take effect in 4 years, which will give us time to do it right. In the meantime, for those Americans who can't get insurance today because they have pre-existing medical conditions, we will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill. This was a good idea when Senator John McCain proposed it in the campaign. It's a good idea now, and we should all embrace it. Even if we provide these affordable options, there may be those, especially the young and the healthy, who still want to take the risk and go without coverage. And that's why under my plan, individuals will be required to carry basic health insurance, just as most states require you to carry auto insurance. Some of people's concerns have grown out of bogus claims spread by those whose only agenda is to kill reform at any cost. The best example is the claim made not just by radio and cable talk show hosts, but by prominent politicians, that we plan to set up panels of bureaucrats with the power to kill off senior citizens. Now, such a charge would be laughable if it weren't so cynical and irresponsible. It is a lie, plain and simple. Also, those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally. It's not true. And one more misunderstanding I want to clear up. Under our plan, no federal dollars will be used to fund abortions, and federal conscience laws will remain in place. Now, but an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange. Let me be clear. It would only be an option for those who don't have insurance. No one would be forced to choose it. And it would not impact those of you who already have insurance. In fact, based on Congressional Budget Office estimates, we believe that less than 5% of Americans would sign up. Public colleges and universities provide additional choice and competition to students without in any way inhibiting a vibrant system of private colleges and universities. But I will not back down on the basic principle that if Americans can't find affordable coverage, we will provide you with a choice. Everyone in this room knows what will happen if we do nothing. Our deficit will grow, more families will go bankrupt, more businesses will close. More Americans will lose their coverage when they are sick and need it the most, and more will die as a result. We know these things to be true. Thank you. God bless you, and may God bless the United States of America.
That was President Obama's second address to a joint session of Congress, his 20th.
And the ones who shared their
It has been a wild day in the battle over health care reform. In Washington, opponents of President Obama's reform plan held a raucous demonstration and then descended on Congress, just as the president was making a surprise appearance to trumpet two major endorsements of his proposal. John Carl reports from Washington tonight.
The town hall fury of August has come to Capitol Hill.
Madam Speaker, throw out this bill.
Thousands of demonstrators rallied on the Capitol steps. and stormed the halls of Congress, ripping up pages of the Democratic health care plan and chanting, "Kill the bill." Several were arrested near Speaker Pelosi's office, and outside, defiant House Republican leaders.
This bill is the greatest threat to freedom that I have seen in the 19 years I've been here in Washington.
Not one Republican will vote for this bill.
And angry protesters.
This health care bill is a disaster. 2,000 pages of crap.
I don't believe that I should have to take care of somebody else's health. Take care of your own health. It's going to devastate America.
The hastily planned protest drew one of the largest crowds in memory for a congressional event.
The crowd extends all the way up around to the House side of the Capitol building, across to the Senate side, literally surrounding the western front of the Capitol.
While Republicans protested, President Obama touted two big endorsements of the health care bill from the AARP and the American Medical Association.
I urge Congress to listen to AARP, listen to the AMA, and pass this reform for hundreds of millions of Americans.
Health care for all.
In much smaller numbers, pro-health care reform protesters also hit Capitol Hill.
Shame on Senator Lieberman. Shame.
And were arrested for occupying the office of Democrat Joe Lieberman, who has said he may join Republican efforts to kill the Senate bill.
Speaker of the House Nancy Pelosi is hoping that those AMA and AARP endorsements will help her pass the Democratic bill in the House by this weekend, but she is not there yet, Charlie. She still needs to get the votes. In a bid to help get her there, President Obama is going to be up here on Capitol Hill tomorrow to rally Democrats.
But we could have a vote, John Bill would.
Mr. Speaker, at this time I'd like to yield to being lived right now in our country, in every one of our districts, in every one of our towns and counties and municipalities. In the anxiety of the family that finds itself paying more and more each year for the health insurance that grows weaker and weaker. In the frustration of the small business owner weighing the choices of dropping her employees' coverage against the threat of being driven out of business by her competitors. And in the fury of the patient who learns that an insurance company bureaucrat has deemed him too sick for the coverage he paid for.
Mr. Speaker, at this time I'm very pleased to recognize and to yield 1 minute to the gentlelady from Connecticut, Rosa DeLauro.
Gentlewoman is recognized for 1 minute.
I rise at this historic moment in support of the Affordable Health Care for America Act. None of us will again have such an opportunity in our time serving in the United States Congress to do something so enduring and fulfilling, to make sure that every American shall have access to quality, affordable health insurance. For more than...
I'd like to yield 1 minute to the gentlelady of California, a member of the committee, Congresswoman Mary Bono Mack.
Gentlewoman is recognized for 1 minute.
I thank the gentleman for yielding. And Mr. Speaker, I rise today to express my strong opposition to this bill. It's a bill that flies in the face of the Hippocratic Oath which both my father and grandfather took as young doctors, which says do no harm. In fact, this bill does a tremendous amount of harm and would inflict an enormous burden on current and future generations of Americans. It would raise insurance premiums, raise taxes, and create huge new government bureaucracies to stand squarely between patients and doctors.
From Texas.
Ms. Speaker, I'd like to recognize my good friend from Georgia, the ranking member of the subcommittee ranking member, Mr. Nathan Deal of Georgia, for 2 minutes.
Gentleman is recognized for 2 minutes.
I thank the gentleman. I rise in opposition to this bill, and I express three major concerns. First of all, I'll raise a question. The question is, by what authority in the United States Constitution gives this Congress the right to mandate that every citizen must purchase a health insurance policy, and upon failing to do so, shall be fined and possibly imprisoned. I think the answer to that question is there is no such constitutional authority.
Every year passed, over 80,000 African Americans died whose deaths were preventable because they were unable to get health care. This bill is for all people of color, those in our rural areas and territories.
It's a great day for women. Our bill stops gender rating, preventing insurance companies from charging women 48% more than men for the same coverage. We eliminate pre-existing conditions. Being a breast cancer survivor or domestic violence victim will no longer prevent access to care. We require coverage of maternity and well baby care. We ensure.
Recognize Congressman Frank Wolf of Virginia for unanimous consent request.
Gentleman's recognized.
Stand advised of strong opposition to the bill. Our nation is going broke. Thank you.
Mr. Speaker, there will be another victim. There is nothing more sacred than the bond between a mother and a child, that trust, that love, that nurturing when that child is sick. And when a mother goes to the doctor under that 2,000-page bill, that relationship that they enjoy between their patient and their doctor and what that mother wants for that child is no longer sacred. Government, through forced government insurance, to ration and deny care. You have violated the most important trust, the most important thing that we have in the building block and the foundation of the values of this country.
A proud grandfather from the great state of Arizona, Congressman John Shadegg of Phoenix, for 1 minute, and his granddaughter.
I thank the gentleman for yielding, and I wish this was my granddaughter. This is Maddie. But Maddie believes in freedom. Maddie likes America because we have freedom here, and Maddie believes in patient choice health care. She asked to come here today to say she doesn't want the government to take over health care. She wants to be able to keep her plan. You see, Maddie says, don't tax me to pay for health care that you guys want. If you want health care, pay for it yourselves. Because it's not fair to pass your health care bills onto me and my grandchildren. Thank you, Maddie.
What am I to say to the young writer who, for years, paid her premiums, and then when she got pregnant and had her baby, they gave her a present on the way out of the door that she could not afford, a $22,000 bill? What do I say to the lady who suffered from breast cancer in my district, and when she lost her job, lost her insurance, could not get insurance, could not get it because of something called pre-existing conditions? I would say to all those folks who are saying that we do not need this and must not do this, we have a moral authority to our fellow citizens, a moral authority. And with that, I yield back.
Thank you, Mr. Speaker. We've heard a lot of discussion in this debate about the uninsured and the uninsurable. Often it's easiest to think about people with pre-existing conditions who are uninsurable as the poor, the sick, or the jobless. Mr. Speaker, the face of the uninsurable stands before this House today in this well. As a breast cancer survivor, the sad reality of today's healthcare system is that if I lost this job tomorrow, I could not buy health insurance coverage because I have a pre-existing condition. All that. The affordable.
This is an historic day. As President Kennedy said in his book, Profiling Courage, there comes a time when men must act according to the dictates of their conscience and not according to political expediency. We have a mission. We have a mandate. We have a moral obligation to lead this nation into a new era where health care is a right and not a privilege. Now,
the gentleman from New York reserves the balance of his time. The gentleman from Michigan, Mr. Camp, is recognized.
At this time, I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentlewoman from Florida, Ms. Brown-Waite.
The gentlelady from Florida is recognized for 2 minutes.
I thank the gentleman. Mr. Speaker, the bill before us creates 111 different offices, bureaus, commissions, programs, and entitlements. But guess what? It only cuts one. It cuts Medicare. This bill steals more than $500 billion from our nation's seniors to fund new entitlement programs for the young, the healthy, and the wealthy.
In overall quality, unacceptable in America. We are 41st in infant mortality. That means in 40 other countries, from birth to 1 year of age, kids live by a higher percentage than they do in the United States. Unacceptable in America. We are dead last of any industrialized country in preventable deaths. Unacceptable in a good and generous nation. This is a
At this time, Mr. Speaker, I yield 1 minute to the gentlewoman from Oklahoma, Ms. Fallon.
The gentlelady from Oklahoma is recognized for 1 minute.
Mr. Speaker, the American people understand the need for health care reform. They just don't want socialized medicine. They don't want the federal government taking over our health care decisions, taking away our freedoms of choice about health care. They don't want more federal deficit spending on the backs of our children and future generations of our children, and they don't want more taxes upon small business, especially in this recession. They don't like the federal government taking away our freedoms guaranteed under this Constitution, and they don't like the federal government interfering in our states' rights. They don't want unfunded mandates upon the states, and they don't want funded government-funded taxpayer abortions upon our families. You know,
when you look at this infrastructure that's there, it's going to require tens of thousands of new federal employees. The American people want two things from health care reform. They want lower cost, and they want